The Health Portfolio Committee has conducted an oversight visit at the Tembisa Tertiary Hospital. This after Health Ombudsman Malegapuru Makgoba released a report on the care and death of Shonisani Lethole at the hospital. The report revealed that Lethole wasn't given food for 100 hours during his stay. More families have since broken their silence regarding the treatment of their loved ones at the facility. Our reporter Nkosazana Dambuza is following that story for us and joins us from the newsroom. Nkosazana, the Health Portfolio Committee was at the Tembisa Hospital today. What did they observe while they were there?
Yes, Andli. So the chairperson of the Provincial Portfolio Committee on Health, as well as the chairperson of the Parliamentary Portfolio Committee on Health, Dr. Shonisani Lethole, conducted an oversight visit at the hospital where they found that indeed the hospital was not actually ready for COVID-19, and we know that a report by the Health Ombudsman also found that that was a report that was looking into the death of Shonisani Lethole, also found that, in fact, the hospital is not at all ready for COVID-19. It's not prepared to deal with the COVID-19, despite the fact that it was earmarked to be a COVID-19 treating facility last year in the beginning of the lockdown. Now, what the Portfolio Committees raised is a concern over the state of the hospital. Just looking at the fact that the Tembisa Hospital is actually a tertiary institution, but they say that the hospital is only operating at the level of a district hospital, which is rather concerning. And they say next week they will definitely be meeting with the Gauteng Health Department to seek answers as to why that hospital is not receiving the adequate support that it needs to perform at optimum level. But let's take a listen to what Dr. Shonisani Lethole had to say.
This coming Wednesday, we'll have a portfolio committee where MEC, Gauteng and Health will be actually speaking to the Portfolio Committee on issues of their readiness to roll out the vaccine and the issues of the COVID-19 updates. We will not miss to ask more about this hospital when we meet with the MEC. I need to actually upfront indicate that it was a good decision that was taken in 2012 to make this hospital a tertiary hospital. Ekurhuleni Metro is a large metro with a lot of people to be served. But however, when resources like infrastructure, equipment, and HR did not follow that pronouncement, then that pronouncement might as well not have been made, because that needed to be supported. We have listened to the leadership of the hospital. We need to actually be able to listen to other leaders, including the writer of the report. But things that are in the report that, of course, you cannot condone is one, if you haven't recorded, if you have not kept your records properly, you just can't defend what actually is there. So where there are no records, it's very indefensible to do that.
Nkosazana, what is the Department of Health saying?
So we know that when speaking to the media recently, the Gauteng Department of Health said that they will not be taking that report on review. But in terms of their response to the calls for the hospital CEO as well as the accounting officer to be suspended, they say that they don't believe that reacting in that manner is the appropriate manner. But what they will be doing is definitely looking and investigating all the complaints that have been lodged against the hospital, and as well as, from there determine who exactly in the hospital is responsible for the lack of service delivery in that particular hospital. But let's take a listen to this.
Department cannot be reactive to get rid of people when there are complaints raised about the type of treatment they are receiving in the hospital. The correct thing is for those who are having issues with the hospital to come forward and raise them. They can also raise issues with us as a committee, because our role is oversight on health facilities. We are open 24 hours. They send issues and we address them through the hospital management, and we give feedback to all the complaints that are raised. So it is our role. We take every complaint and we investigate. We've got also the Office of the Public Service Commission Where we don't get sufficient information from the department, we raise those with the Public Service Commission because that office has capacity to do investigation on behalf of us. So the getting rid of the CEO, we do not agree with it until there is tangible evidence to indicate that indeed a mistake was done. However, with regard to the late Mr. Lethole, on issues where a wrong was done, we say consequences must be done to those who didn't do their job.
Thank you very much. That was reporter Nkosazana Dambuza.